Hello, how are you doing? This is my application to the YLC Entrepreneurship Program, and the product that I want to design and produce is a compliant surface trainer. A compliant surface trainer is an 8-foot long by 2.5 foot wide and 1 foot thick gel-filled pad that is meant to simulate a compliant surface for our balance impaired individuals to train on and improve their balance and decrease their fall risk in a safe clinic-based environment. This device is backed by objective data proving that doing balance exercises or balance interventions on a compliant surface can decrease a patient's fall risk and increase their dynamic functional balance. So before I dive into our marketing scheme and a little bit about our mission statement, I'm going to go over some fall facts and some financial implications of falls in order to really address why this device is important for the healthcare system to not only improve patients' health status, but also prevent falls and prevent the financial ramifications that come along with falls. So, some fall facts. 1 in 4 adults over the age of 65 falls each year. That is 25% of our geriatric population falling each year. Each year, 3 million individuals are treated in emergency rooms for falls or fall-related injuries. 300,000 older adults are hospitalized each year for hip fractures. 95% of those hip fractures are a result of falls. Falls are the most common cause of traumatic brain injuries. One may think that car accidents or contact sports would be the most common cause of traumatic brain injuries, but it actually is falls. By 2030, it is projected that there will be 49 million individuals yearly who fall and 12 million in fall-related injuries. Then this last point, environmental hazards result in a 10-time increased risk for a fall. An example of an environmental hazard is a varying surface or a compliant surface. When you go from your hardwood leveled kitchen into a carpeted living room or bedroom, you are entering an environment that has a varying compliant surface. You have carpet that complies and adjusts to your foot as you walk, and it is shown that environmental hazards like that compliant surface increase our risk for a fall. So if we know that and we train our patients on these compliant surfaces, adjusting their dynamic balance, making muscular adjustments to their balance as they walk on this compliant surface trainer, we can increase their ability to display competent levels of dynamic balance and decrease their fall risk. Some financial implications of falls. The average fall results in $30,000 in hospital costs. And in 2015, total medical costs for falls totaled more than $50 billion. 75% of that $50 billion budget being covered by our federally funded insurances like Medicare and Medicaid. And bridging right into our marketing strategy to change this financial trend and this trend of patients having adverse health events related to falls. So we would market to MDs and medical providers because they are the ones who initially see these patients, recognize they are unsteady in walking, and are able to detect that they are a fall risk. So if they are aware that there's a product out there that is designed to improve dynamic balance, they can recommend it to other healthcare providers like physical therapists that will primarily utilize the device. Insurances, especially our federally backed insurances, our Medicare and our Medicaid that we saw have such a financial burden related to falls and fall-related injuries, we can discuss with them and make them aware of a device that can improve patients' functional balance and therefore curb some of the actual financial implications of falls. Physical therapists. Physical therapists are the ones that are going to be primarily working with these at-risk patients for falls in clinic, and they are going to be the primary utilizers for this device. So they are a great group of individuals and realm of healthcare to market this device to. And then finally, medical administration, the ones that are primarily making the financial decisions about whether the device is worthwhile to them or if it fits in their healthcare environment, is another group of individuals that we would try and market this device to. And finally, our mission statement here at Balance Solutions is: Balance Solutions and their dynamic balance device, the compliant surface trainer, are solely focused on improving the functional ability of the balance impaired population while diminishing fall-related medical expenses. And what this mission statement is outlining is the fact that this is bigger than just an entrepreneurial opportunity and an endeavor for me. This is actually an opportunity to make a real difference in a group of people in the balance impaired population and the geriatric population that is experiencing a decrease in their functional ability and their level of function due to a fear of falling, an inability to participate in community events because of the risk of falling, but also an opportunity to save our healthcare providers and our health insurance companies a great deal of money and financial capital just due to a device that is focused on preventative care, preventing these patients from falling by addressing their dynamic balance before an incident, as to just working with these patients and trying to fix the adverse events that are related to a fall after the fall actually occurs. And something I've asked myself constantly as I've designed and put together the blueprint for this device is, what can we do to change the health status of the geriatric population, and how much of a difference can we make in fall prevention programs? And as I go about establishing this device and producing it, I'm going to continue evolving and figuring out the answers to these two questions, and I hope that you guys help me with a little bit of financial means to be able to answer these questions alongside me. Thank you guys for the opportunity. I really appreciate it from the bottom of my heart. I hope you enjoyed the video.